According to the Centers for Disease Control, the fertility rate in the United States reached its lowest level in history in 2016. Births among U.S. teens fell by 9%, while the overall birth rate fell by 1%. And there were just 62 births per 1,000 women ages 15 to 44. Dr. Christin Drake is an assistant attending psychiatrist at the New York Presbyterian Hospital, and she joins me now. Doctor, welcome.
Thank you for having me.
So as we mentioned, the U.S. fertility rate hit a record low in 2016. What are some of the factors that might have contributed to that?
Well, there are two groups I think that are worth looking at in this in the decline in birth rates. The first group, and I think the most encouraging, is the teen birth rate decreased significantly and has continued to do so. That's a continuing trend. And in that group, we think that the most significant factor in that decrease is increased availability and use of highly effective contraception among teenagers.
So that's the main reason behind that. What about when it comes to preterm births and low birth weight babies? Those rates did increase in 2016. And I wonder, do you have a sense, do we know if this is a trend or perhaps just an outlier?
It's the second year in a row that these two measures have increased, and so that's concerning. If there's something that's reassuring in that data, it's that very early preterm births did not actually increase. It was later preterm births that did, and we worry less about those babies than babies who were born very, very early.
Still concerning, though. Yeah.
Yes, and also very low birth weight births also did not increase. It was sort of moderate low birth weight. But it is concerning, and I think there are racial and ethnic disparities among the likelihood that a baby is born with a very low birth weight or preterm. So that's something that we worry about in terms of access to prenatal care. And we know those very same groups of women of color, have more difficulty accessing care early in their pregnancies. So that's something to be concerned about.
So what else stood out to you? There's a lot of statistics in this report, and I wonder what jumped out for you when it comes to this report.
You know, the shift, I think what was most interesting to me, the shift in between women in their 20s and women in their 30s and 40s. So women throughout their 20s actually decreased their birth rates. Women in their 30s and 40s increased their birth rates.
That's a change, yeah.
It is. It is, and I think it reflects, you know, honestly, what happens when women have access to more control over when they have children and how many children they have. And it seems that, you know, women are choosing to have babies a bit later and to have fewer children. And that is what's working for them.
And the science allows women now to make that decision to have babies later. That's not something that existed necessarily in decades past. So, all right, well, this is certainly a very fascinating look. So, as you know, some people are already, though, wondering about what this could mean. What could the implications mean for the country and the economy? Are there going to be enough babies born to fill the workforce to ensure that the United States has the workers that it needs? Is it, you know, one report, it's difficult to make any kind of blanket statement about that, right?
It is, but I think that if there is, you know, we're slightly below the replacement rate, you know, this report tells us, but it's not something that we have to worry acutely about. There is enough immigration and there are enough new workers joining the economy that that's not something we really have to worry about. I do think, though, that if we're going to be discussing as a nation, you know, women's fertility rates, that we have to also be thinking about the reasons why people might be choosing to have fewer children and to have them later. And I think those include things like wage disparity and the lack of a parental leave policy in this country. I think when women are able to choose because of the availability of effective contraception, they're choosing, you know, things that work for them, and it's difficult to encourage people to have more children without that support.
Yeah, it's a huge decision. All right, Dr. Christin Drake, thank you so much for stopping by. I appreciate it,
Thank you for having
Doctor.
me.